If you're turning 65 in 2026, you've probably heard that Medicare starts at age 65. But what you haven't heard is that your decisions this year may determine the rest of your retirement health care. And a wrong move now could cost you thousands or leave you without the coverage you really want when you need it the most. In this video, I'm going to walk you through exactly what to do if you're turning 65 in 2026, step by step. We'll cover timelines, critical decisions, and common mistakes to avoid. So step one is you need to know your timeline. Medicare doesn't just show up on your birthday. Your enrollment window starts long before that. Enrollment in Medicare Parts A and B is not automatic. Only people on Social Security income at least 4 months prior to their 65th birthday month are automatically enrolled in Medicare. Everyone else must enroll or have creditable health insurance substitute in order to avoid penalties, like a large employer group plan. Now, I have linked above my left shoulder and in the show notes below a cheat sheet on what is creditable health insurance coverage for Medicare. You'll also find it on my website, MedigapSeminars.org, under the Resources tab. Your initial enrollment period, often called IEP, begins 3 months before the month you turn 65. It includes the month you turn 65 and ends 3 months after your birthday month. For example, if you turn 65 in September 2026, your initial enrollment period runs from June 1 to December 31, 2026. Now, there's one exception to this rule. If your birthday lands on the first day of a month, then your entire enrollment period moves up by 1 month. For example, if your birthday is September 1, your Medicare can start August 1, and your initial enrollment period runs from May 1 through November 30th. When you do enroll for Medicare Parts A and B, you do that through the Social Security website. Very easy links to follow to enroll in Medicare only and not Social Security, if that's your choice. So why this matters? If you miss your initial enrollment period, you may face late penalties or delays. You'll have to wait until the general enrollment period, which is the first 3 months of the year, January, February, and March, the following year. Now, if this is confusing, check out my free enrollment calculator on my website, MedigapSeminars.org, or ask the AI chatbot on my website. It will direct you to the calculator. And also, watch my playlist on Medicare enrollment videos. I should have it linked up here somewhere. Step 2, you should decide between Medicare Advantage and Original Medicare or Original Medicare plus a supplement. You must choose one of 3 Medicare paths, and your choice affects your doctors, your coverage, and your cost. So path 1 is you just stay on Original Medicare and add a Medicare Part D prescription drug plan. Now, you can see any doctor, visit any medical facility in the United States or U.S. territory that accepts Medicare. Plus, no insurance company can interfere with your decisions. Your healthcare choices are between you and your doctor. Unfortunately, because of coinsurance and deductibles, you have theoretically an unlimited financial risk in the case of a prolonged serious illness. And path number 2 is a Medicare Advantage plan, some people refer to as Part C. Medicare Advantage plan is a private insurance plan that replaces Original Medicare. They'll often include a prescription drug plan, a bundled Part D plan. Now, these plans are network-based, like an HMO or a PPO. You have a network of doctors and hospitals that you're limited to. You can only see the medical providers that have or are willing to contract with the insurance company. The insurance company controls your health care. Medicare Advantage plans set a maximum out-of-pocket for Medicare services approved by the insurance company. And you still must pay your Medicare Part B premium, even though you have replaced Original Medicare. So the third choice, the third path, is Original Medicare plus a Medicare supplement, also known as a Medigap plan. Now, this includes all of the benefits I just mentioned of Original Medicare, the freedom that you have with Medicare Parts A and Part B. You then add a supplement often like a Plan G or Plan N or high deductible plan. And that supplement offers you predictable and limited Medicare expenses. You add the Part D of your choice, and if you can still see any doctor and visit any medical facility that accepts Medicare. Medicare Advantage is heavily marketed, but not always the better choice. If you're finding this video helpful, click the like button below, please. It helps others find this video and it helps the channel out a lot. And if you want more videos like this, subscribe to this channel. We post new videos regularly. So step 3, understand the key Medicare parts. So here's a quick breakdown. Medicare Part A is your hospital or inpatient coverage. It is whenever you are an inpatient in a hospital or medical facility, Part A takes over. Now, it has no premiums because it's usually paid for by your payroll taxes from your working years. Medicare Part B coverage is for outpatient care and doctor visits. That does have a premium, and that premium is based on your income. Medicare Part C, a Medicare Advantage plan, is a private alternative. It replaces original Medicare. And Part D, prescription drug plans, is for those prescriptions that you get when you go to the pharmacy and pick up a prescription, or you have one mail order. And Medicare supplements that we mentioned earlier, like the Plan G or a Plan N or a high deductible plan, they don't increase the things that your Medicare covers. What they do is pay the coverage gaps. They will pay the deductibles, co-pays, co-insurance that are left from Medicare Parts A and B. And if Medicare approves the service, then your Medicare supplement plan will pay its portion. Keep in mind, if you were thinking, what does Medicare cover as far as medical services? Medicare's intent is to cover everything that's medically necessary to diagnose or treat any disease, injury, or condition. The key term being medical necessity. You can't just ask for a kidney transplant. You have to need one. Original Medicare plus a supplement. So that's Medicare Part A, Medicare Part B, Medicare Part D, plus your Medigap plan is the option with the greatest insurance coverage. Medicare Advantage plans replace Medicare Parts A and B and often include a bundled Part D. So let's look real quick on step 4, which is to avoid some common mistakes. Mistake number 1, enrolling too late. If you miss your window, you can face lifetime penalties on Medicare Part B. Mistake number 2, choosing a plan based on premium alone. A $0 Medicare Advantage plan can have a $9,250 maximum out-of-pocket for any calendar year, and that's only for in-network services. If you also have out-of-network approved services approved by the insurance company, you can have expenses up to $13,900. Low premium, but you're going to pay when you have your services. So don't just shop premium. Look for the plan that best suits your needs and your budget. So mistake number 3, not comparing Medicare Part D prescription drug plans. So drug plans change annually, and overpaying for a drug plan is very common. Everything about a Part D plan can change each and every year. So during the annual enrollment period from October 15th through December 7th of every year, you need to reshop your plan. Look for the plans for the coming year. You simply choose the plan you want, enroll in it, and Medicare will cancel your previous plan. And mistake number 4, this is probably worded wrong, but it's trusting the wrong agent. Most agents that sell Medicare only work with Medicare part-time. They're primarily life insurance or annuity agents. You want a full-time Medicare specialist to get it right and to get you the answers that you need and the questions that you have, and has experience with Medicare and with the Medicare insurance companies. So step 5, talk to a licensed, independent Medicare specialist early. Don't wait until the last minute. You can start talking about a Medicare supplement plan up to 6 months before you expect your Medicare to start. At Medigap Seminars, we specialize in helping people like you make smart decisions with no pressure and no sales games. We'll walk you through your options and help you enroll at the right time with the right coverage. So what do you do right now? Well, here's what I would suggest that you do today if you're turning 65 in 2026. Mark your initial enrollment period on your calendar. Again, if you're not sure what that is, go to MedigapSeminars.org, ask the chatbot for the Medicare initial enrollment or enrollment calculator, and it'll give you the link to that spot. Start researching before all these ads flood in, and they will flood in by mail, phone calls, text, and that can get very confusing. People that seem to be less stressed are the ones that do their research before that happens so that they've already got some answers and end up saving a 3-foot pile of mail. And get a personalized consultation. We offer this at no charge. Our services are free to the consumer because whichever insurance company that you choose to work with will pay us. Subscribe to this channel for future Medicare updates. Talk to someone who puts your interest first. Call our office or send us an email. We'll help you build a Medicare roadmap that fits your health and your wallet. If this helps you, please like and subscribe. I'm Matthew Claassen with MedigapSeminars.org. Thank you for watching.